In today's video, we are going to talk about a serious sleep disorder called sleep apnea. Sleep apnea affects millions of people worldwide and can have significant health consequences if left untreated. Join us as we explore the danger signs of sleep apnea and learn how to recognize and address this condition. Did you know that sleep apnea is estimated to affect approximately 936 million people globally? According to the American Sleep Apnea Association, around 22 million Americans alone suffer from this condition. That's a staggering number. And what's even more alarming is that up to 80% of cases remain undiagnosed. Sleep apnea can affect individuals of all ages, including children and adults. It is more frequently diagnosed in adults, particularly middle-aged and older individuals, and it is more prevalent in men than in women. Recognizing the symptoms promptly is crucial for early intervention and effective management. So, let's understand this condition in depth. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. These pauses, known as apneas, can last for a few seconds to minutes and can occur multiple times throughout the night. Sleep apnea disrupts the normal sleep cycle, leading to poor sleep quality and various health issues. The classic symptoms of sleep apnea include loud and chronic snoring, episodes of gasping or choking during sleep, and excessive daytime sleepiness. These symptoms are often reported by the bed partner or family members who notice the interruptions in breathing. However, there's much more to it than these well-known signs. Let's explore the 10 key symptoms of sleep apnea that you need to be aware of. 1. Loud and chronic snoring. Snoring is a common symptom of sleep apnea, and it is usually loud and disruptive. It occurs due to the partial blockage of the airway during sleep, leading to the vibration of tissues in the throat. 2. Pauses in breathing. Episodes of breathing cessation during sleep, often followed by gasping or choking sounds, or waking up suddenly feeling like you can't breathe. These episodes occur when the airway becomes completely blocked, leading to a temporary pause in breathing. 3. Frequent urination at night, waking up multiple times to urinate during the night, disrupting sleep. The interruptions in sleep caused by sleep apnea can disrupt the normal production of hormones that regulate urine production. 4. Restless sleep, tossing and turning during sleep, being unable to find a comfortable position. 5. Morning headaches, waking up with a headache that subsides as the day progresses, which may be caused by oxygen deprivation during sleep. It's important to note that morning headaches can have various causes, and not all morning headaches are linked to sleep apnea. 6. Dry mouth or sore throat, waking up with a dry mouth or a sore throat due to breathing through the mouth during sleep. 7. Excessive daytime sleepiness, feeling excessively tired or sleepy during the day, even after a full night's sleep. 8. Lack of concentration, difficulty focusing, memory problems, reduced cognitive function, and finding it hard to focus and stay alert during the day. 9. Irritability and mood swings, feeling irritable, impatient, or experiencing mood swings. 10. Decreased libido. A noticeable decrease in sexual desire or performance may occur with sleep apnea. It is important to note that while some individuals with sleep apnea may experience this, it is not a symptom that affects everyone uniformly. Remember, these symptoms should be considered collectively and not in isolation, and not everyone with sleep apnea will experience all of them. It's important to consult with a healthcare professional for a proper diagnosis. While these signs can raise suspicion for sleep apnea, they can also be caused by various other conditions. Now that we've discussed the recognition and symptoms of sleep apnea, it's time to dive deeper into the causes, diagnosis, treatment, and prevention strategies. But before we continue, make sure to hit that like button, subscribe to our channel, and enable notifications so you never miss an update from Healthy Factors. Sleep apnea can have several underlying causes. Let's explore the main ones. Obstructive sleep apnea, OSA. This is the most common type of sleep apnea and occurs when the muscles in the throat relax, leading to a partial or complete blockage of the airway. Central sleep apnea, CSA. This type of sleep apnea is characterized by a lack of respiratory effort due to a temporary absence of respiratory drive from the brain. It's less common than OSA but can be caused by certain medical conditions or medications. Mixed sleep apnea, also known as complex sleep apnea, is a condition where a person initially presents with central sleep apnea, but it progresses to include obstructive events as well. In addition to the primary causes, certain health conditions and lifestyle choices can increase the risk of developing sleep apnea. Here are a few connections to keep in mind. Obesity. Excess weight can contribute to the development of sleep apnea as it increases the amount of soft tissue in the throat, narrowing the airway. Smoking and alcohol consumption can relax the muscles in the throat, making them more prone to collapse during sleep. They can also worsen the condition in individuals who are already predisposed to sleep apnea. Family history. Sleep apnea can run in families, suggesting a genetic component to the condition. Age. Sleep apnea becomes more common as we age, with middle-aged and older adults being at a higher risk. Gender. Men are more likely to develop sleep apnea than women, although the risk increases in women after menopause. Nasal congestion. Chronic nasal congestion or structural abnormalities in the nasal passages can contribute to sleep apnea by obstructing airflow. If you suspect you have sleep apnea, a healthcare professional can conduct various diagnostic tests to confirm the condition. Here are some common diagnostic procedures. Physical examination. A healthcare provider may examine your throat, mouth, and neck to look for physical signs of sleep apnea, such as enlarged tonsils or abnormalities in the airway. Polysomnography, PSG. This overnight sleep study involves monitoring brain activity, eye movements, heart rate, and breathing patterns to detect sleep apnea and assess its severity. Home sleep tests. In some cases, a healthcare professional may provide you with a portable device to conduct a sleep study at home. This can be a more convenient and cost-effective option for diagnosing sleep apnea. Oximetry. This test measures the oxygen levels in your blood while you sleep and can provide insights into potential breathing disruptions. Once diagnosed with sleep apnea, there are several treatment options available to help manage the condition effectively. Treatment approaches may include CPAP or continuous positive airway pressure therapy. Involves wearing a mask over your nose or mouth while you sleep. The mask delivers a continuous stream of air, keeping the airway open and preventing pauses in breathing. Oral appliances. Dental devices can be custom-made to reposition the jaw and tongue, helping to keep the airway open during sleep. Lifestyle modifications. Making certain lifestyle changes can significantly improve sleep apnea symptoms. These changes may include weight loss, regular exercise, avoiding alcohol and sedatives, sleeping on your side instead of your back, and practicing good sleep hygiene can all contribute to managing sleep apnea. We'll be discussing these tips and strategies in greater detail very shortly. Stay with us so that you don't miss out on any valuable information. Surgery. In some cases, surgery may be recommended to remove excess tissue, repair structural abnormalities, or implant devices that help keep the airway open. It is not the first-line treatment and is typically considered when other treatment options have been ineffective or in specific cases where surgical intervention is deemed necessary. It's important to work closely with a healthcare professional to determine the most suitable treatment plan for your specific case of sleep apnea. If left untreated, sleep apnea can have significant long-term health consequences. It has been linked to an increased risk of high blood pressure, heart disease, stroke, type 2 diabetes, and even depression. High blood pressure. Sleep apnea is strongly associated with high blood pressure, and untreated sleep apnea can make it challenging to achieve optimal blood pressure control. Cardiovascular disease. Sleep apnea increases the risk of developing various cardiovascular conditions, including heart disease, heart failure, and stroke. Type 2 diabetes. Individuals with sleep apnea have a higher risk of developing type 2 diabetes. This may be due to the disrupted sleep patterns and the impact on insulin sensitivity. Mental health disorders. Sleep apnea has been linked to an increased risk of mental health conditions such as depression, anxiety, and cognitive impairment. The chronic sleep deprivation and oxygen deprivation associated with sleep apnea can have a negative impact on mental well-being. Weight gain. Sleep apnea and obesity often go hand in hand. The condition can contribute to weight gain, and excess weight can worsen sleep apnea symptoms, creating a vicious cycle. Fatigue and decreased productivity. Sleep apnea can lead to persistent fatigue, reduced energy levels, and impaired cognitive function, affecting performance at work or school. Relationship strain. Loud snoring and disruptive sleep can strain relationships with bed partners, leading to conflicts and sleep disturbances for both individuals. Increased accident risk. Daytime sleepiness caused by sleep apnea can increase the risk of accidents, both on the road and in other areas of life. While some risk factors for sleep apnea, such as age and genetics, cannot be controlled, there are preventive measures that individuals can take to reduce the risk of developing the condition. Here are 8 useful lifestyle tips and preventive strategies for improving sleep apnea. 1. Maintain a healthy weight. If you are overweight or obese, losing weight can significantly reduce the severity of sleep apnea or even resolve it altogether. Aim for a balanced diet and regular exercise to achieve and maintain a healthy weight. 2. Avoid smoking and excessive alcohol. Both smoking and excessive alcohol consumption can contribute to sleep apnea. Quitting smoking and moderating alcohol intake can have a positive impact on your sleep and overall health. 3. Sleep on your side. Sleeping on your back increases the likelihood of the tongue and soft tissues in the throat collapsing and blocking the airway. Try sleeping on your side to keep the airway open. 4. Establish a regular sleep schedule. Maintain consistent sleep patterns by going to bed and waking up at the same time each day. This can help regulate your body's internal clock and promote better sleep quality. 5. Create a sleep-friendly environment. Make your bedroom conducive to sleep by keeping it cool, dark, and quiet. Use comfortable pillows and a supportive mattress to ensure optimal sleep posture. 6. Practice good sleep hygiene. Adopt healthy sleep habits such as avoiding electronic devices before bed. The blue light emitted by screens can disrupt the body's natural sleep-wake cycle, making it harder to fall asleep. 7. Keep nasal passages clear. If you have nasal congestion, use saline nasal sprays or decongestants to help keep the airway open. 8. Stress management. High levels of stress can negatively impact sleep quality and contribute to the development of sleep apnea. Implementing stress management techniques, such as relaxation exercises, meditation, or engaging in hobbies, can help improve sleep and overall well-being. By adopting these preventive measures and making positive lifestyle changes, individuals can reduce the risk of developing sleep apnea and improve their overall sleep quality and health. It's important to note that these measures may not prevent sleep apnea in individuals who are already predisposed to the condition due to factors such as genetics or anatomical abnormalities. Sleep apnea is a common sleep disorder with potentially serious health implications. By recognizing the danger signs and seeking timely medical attention, you can take control of your health and well-being. Sleep apnea is a treatable condition, and with proper diagnosis and management, you can experience restful sleep and improve your overall quality of life. Remember, if you suspect you or a loved one may have sleep apnea, consult with a healthcare professional for a proper diagnosis and personalized treatment plan. Thank you for watching, and don't forget to like this video, subscribe to our channel, and hit the notification bell to stay updated on all our latest health content. Stay healthy, and we'll see you in the next video.